age-related hormone decline is considered normal part of aging. But I've found that one of the best biohacks out there for aging, for just a better quality of life, is hormone replacement therapy. So essentially replacing the hormones that we're missing that just start diminishing with age. And it happens to men and women different times. Of course, men, we're just worried about testosterone. Women, you've got a host of them that
A
keep
laundry list.
that fluctuate and change at different times.
Yes.
And
Which can be complex to manage, but it's possible. So,
right,
yeah.
right. And well, actually, both men and women are worried about testosterone. Testosterone's a big deal for men and women. Sometimes testosterone more of an issue earlier for women than menopause, before menopause.
Women actually produce more testosterone than they do estrogen, and very few people know that.
That's true.
Yeah.
Yeah. And so I can start diminishing around 40-ish. So,
or even earlier, it just depends.
Yeah. And with men as well, we see younger and younger men having issues with testosterone than historically. And without getting into deep at the weeds with that, why that might be happening, the important thing is to get eyes on it. Maybe before you're symptomatic, ideally. But if you are symptomatic, know what those symptoms are. Make sure you're not, you're thinking about those symptoms in a way that's not, you're not displacing the reason for them or just chalking it up to age and this is what you have to live with. You have options, right?
Right.
So let's talk about what that may feel like. If you start feeling that decline, that can show itself in a number of symptoms, or maybe just one or two that would be a clue to let's get eyes on it.
Right. And so, and we'll talk about the symptoms in a second, but really what's happening with that, as your hormones are declining as you age, it's affecting these processes in our bodies, right? So it's affecting our ability, our protein synthesis. And part of that, it's affecting our ability for our cells to regenerate. And there's a host of things that it starts affecting, but there's a couple different things at play. Not only is the hormone declining, but the receptor site is aging. So it is not able to receive as much hormone as it once did when we were younger. So we need more of that hormone in order to create the same impact on our body, because our receptor sites just aren't receiving as much of it as it used to. And so then that process, if you're aging and then your receptor sites are aging and then you're not able, it's sort of like this snowball effect.
So you're saying there's two factors. There's
a couple different
decline
factors
in the actual production of the hormone from your sex hormone,
and
your sex organs.
Right.
And then the receptor sites, which are on various tissues around your body. You mentioned protein synthesis, so that's directly related to, say, muscle mass.
Right.
Or tissue regeneration in organs.
Right.
Healing.
Right.
But so you have two factors. One is the production and the other is the reception or the reading of that hormone, which then signals the repair.
Right. And since we have hormone receptors in every cell in our body, it can affect everything, like your skin quality, crepey skin, brain fog. That's a huge one.
Brain fog's a big one,
especially for women. I would say
that's a big one with testosterone decline. It's huge. It's brain fog.
We've got sleep disturbances. That's another really big one.
For sure.
Just quick mood changes.
Heart
right?
health. That the stubborn belly fat. Where you just start developing some insulin resistance, which is the early stages of, like, say, diabetes. But long before diabetes, you basically just put on a little extra fat. Blood sugar numbers are kind of up and down. Maybe that could impact your energy. And you're
kind of like your ambition and your drive as well. So
and that's very much a chemical process.
The whole world starts to turn like grayscale, and you lose. It's not in color anymore. You sort of feel like you're just sort of in the background.
Oh yeah, and libido.
Oh, and that one.
That's a big one.
Right. Speaking of ambition and drive.
I mean,
but
that's
also
which
like
is
muscle
important.
mass, bone density, right?
For
we
sure.
we start shrinking as we get older. You notice that, like, we noticed that in our parents and our grandparents.
Right.
Like they're not as tall as they used to be because things are compressing, right? Tissue is compressing.
Bone isn't regenerating, healing. The little spongy, tissue between in their spine isn't regenerating either. So it affects basically every bit of tissue in your body. It's the aging process, essentially.
It is. It's sort of nature's way of taking us out and
slowing us down. For sure.
So, but when we start talking about this bioidentical hormone replacement therapy and the aging superhighway, because that's essentially what's happening. We're starting to age at a very rapid pace. And if we can keep those hormone levels, where they once were, and it's not necessarily even about like a particular level or a particular, lab level, because what I feel good at and what alleviates my symptoms may be completely different than what alleviates someone else's. We may have the same levels and one is symptomatic and the other isn't. And we see that all the time. So
Yeah.
it really is, something that is tailored to the individual.
Somewhat individualized. Yeah. There are certain ranges that are considered optimal,
Hmm.
that are way above what are considered normal for your
Right.
age, which you
Right.
might hear from your doctor. You go in and get blood work, and maybe they're not really up on hormone replacement therapy and longevity, the longevity space, and they say, "Oh, it's normal for your age. You're fine. You're just getting older. It's
But you're
normal."
losing your mind,
Yeah.
You're like, I
Well, you're
don't
just
feel
not enjoying
normal.
life.
This isn't my norm. This isn't me.
Yeah,
I don't even recognize
and
myself. You're not enjoying life.
it's not enjoyable.
You're struggling at everything. The things that used to be your superpower, you can barely even, access
They just
those.
aren't there.
They're
Yeah.
just not there. You can't finish sentences. You can't find your words. You're not able to work at the same pace that you were. You just don't have that vigor for life that you did when you were younger. And it really does start to impact your relationships,
Yeah.
marriages.
Cor-
Yeah.
Your performance.
Relationships with your kids,
Yeah.
relationships that, well, you said career, but at work, it really does start to impact every area of your life. And there's nothing more frustrating than being told that you're normal when you feel anything but normal.
And we figured out we were somewhat symptomatic. We were in our late 40s before we started with hormone replacement therapy.
I was early 40s, but nobody ran baseline, nobody ran blood work.
Not when you were getting the therapy.
Right.
When
No,
you start
not when
feeling
I get it. No,
symptomatic.
no.
You're
But
saying symptomatic.
I had symptoms in my early 40s, and I was probably perimenopausal at that point. But my physician did not even suggest running blood.
No, she
blood
wanted
work
to
at
give
all.
you antidepressant of some sort,
Right.
which is common. I've heard that with another client of
Right.
mine, actually, who the same suggestion was made by her OB/GYN. And so this can happen for some people. It's late 30s,
Mhm.
mid early 40s. For us, late 40s, we were really feeling it. We've probably
Yeah.
a little longer than we needed to. Thing is, get eyes on it. If you're already 40, get labs.
Yeah.
Get eyes on it. If you're starting to feel some of these symptoms and you're just not sure, get labs. Like
Yeah.
either mark it off
It's
as
your
like,
report card.
yeah, it's like either it is that or it isn't that, and then you know how
But now
to
you, right.
address it.
Right.
But again, to know the difference between normal for your age and optimal ranges, we have created a free download, which has a list of the typical hormones you're going to be replacing.
Right.
So all the sex hormones and thyroid hormones,
Mhm.
with what's considered normal or normal for your age, and optimal,
Mhm.
which is not what many physicians are familiar with. Some have started specializing in this, and they will, take on that kind of in the longevity space, where they want to help you optimize for your health and quality of life. And most of them realize you have the range we're talking about, the optimal range, balanced with like what you're talking about, how you feel, how you're performing, and able to help individualize that on some level, based on symptoms and just quality of how you feel. And so get that free download. That way you feel like you're educated, like you know what you're talking about, you know what you're aiming for when you go speak to your physician, because you should be your own best advocate for your health. And that's what's kind of the purpose of sharing that with you. This is not giving medical advice. This is sharing our experience, but also knowing that most people just don't know where to start. And so if you can have some sort of general range to go off of as kind of a target, like let's start here and then play with it to individualize it,
Mhm.
then you're way ahead of even what many doctors are understanding about this space at the moment.
Mhm.
So get the free download and get just a little bit of education can take you a long way and save yourself a lot of time, and get you on your way to being optimal.
Yeah. So
Instead of
you feel like your old self again,
yeah,
because that's really, I would say that's the thing that
your old
we've,
young self.
right. That when you do start to, when people start optimizing and replenishing some of these lost hormones, they're just like, "Oh my gosh, I feel like a totally different person. Like, this is the old me." You
Yeah.
hear it over and over and over again because that's
The
really what
younger them.
yeah,
Yeah.
the younger them. Yeah,
The
right, right. So they're just like, "I remember this
the
person."
previous younger them. Yeah.
And
Yeah.
it's like, I'm back, and it's a great thing to see for people, and there's just
Yeah.
really no reason to let our bodies just like age and break down when we know that there are some, really great remedies and
Yeah.
things that will not just help us today and, as we age in our 30s, 40s, 50s, 60s, 70s, 80s, beyond, but they're going to help us have what we talk about a lot, which is a better health span and not just a better lifespan because we want more years, but we want those years to be quality years.
Right.
And this is a big, big piece of the puzzle. So
Yeah.
get that free download. Um,
And
w-
check back on some of our other videos so where we go a little deeper dive
right.
on the individual hormones and what you might want to be looking for, some of the specific symptoms related to those hormones, and just a little more information, a little more ammo.
Yeah, a
In
little less fear, a little more information,
Yeah.
and that is just going to do nothing but serve you as embark in this journey we call life through the decades of aging and what we call now biohacking, which is kind of an interesting word, but there's
Essentially,
just
what you're doing is you're hacking your biology to improve your quality of life and your health. So this is
correct,
my favorite. When people ask me, "What's your favorite biohack?" It's hormone replacement therapy,
absolutely, yeah.
hands down, especially for people over 40. So
Right. And I think people are really starting to understand the fact that aging is not set in stone. You are not stuck with the way your parents aged or whatever oh, it's in my DNA. I call BS on that. And it's like you have a lot more control over how you age than we may have previously thought. And there's more things available to us now to have a better quality of life and a better health span than there ever has been before in history. And not only that, but we can exchange information very, very quickly. So
yeah.
get the free download and age better.